Good afternoon, everybody in India, and good morning, those of you, my friends in Switzerland. We welcome you all today to witness the launch of a revolutionary and truly game-changing invention to contain the spread of COVID-19 at the hands of the inventor himself, Mr. Sanjeev Swamy, CEO of Livinguard Technologies, who is in conversation with renowned science leader of our times, Padma Shri, Padma Bhushan, Padma Vibhushan, Dr. Raghunath Mashelkar. Kindly note that this session will be recorded. All participants will be on mute until the end of the session. We request you to please post your questions in the Q&A chat box at the end of the session. In case we are unable to have Sanjeev answer all your questions, we shall definitely have them answered and emailed to you. Kindly be in touch with the team Profit Relations of your respective centers. Thank you. Over to you, Doctor.
Yes, thank you very much, and welcome to you all. I would like to recollect when I heard about Livinguard first. As you know, our Prime Minister Narendra Modi had set us on this Swachh Bharat mission, and he wanted to create defecation-free India. And one of the tasks that was given to us was to get the best technologies from around the world for drinking water and sanitation. And I had the privilege of chairing that standing committee for 5 years. And we were trying to look at technologies not just from India, but from around the world, the very best. And then we came across Livinguard. And what struck me at that time were their claims about purifying 3,000 liters of drinking water for $1 without electricity. Now, I'll tell you what struck me here. Because we had this assured framework for scanning the technologies, which was a very rigorous framework. And that meant affordability, scalability, sustainability, user-friendliness, rapidity, excellence in terms of technology, as well as distinctiveness. And suddenly when I used that screen, I found that it passes all. And particularly when it came to rural villages, anything that you can do without electricity, I said, that's great. But we just don't go by claims, we verify them. So our National Environmental Engineering Research Institute, we put them on the job to verify. And we're very happy to see that the claims were rectified. And what also impressed me was the passion about disinfection, so as to say. Because the viruses, the bacteria, the microbes are all here. And disinfection is going to be sort of, has been always very critical. Now it is coming to the center stage. And therefore, when I was looking at, I was just following their technologies. And then I came across, of course, Sanjeev, I still remember our first meeting. I saw your passion, I saw the innovation, I saw the compassion, and really impressed. And you have, of course, been the founder and inventor, the man behind this sort of breakthrough. So what I intend to do, I'm going to play my role as a scientist to understand in depth as to how it works, why it works, you know, and what implications it has, not only for the current as well as the future. What struck me, by the way, was also, I was not excited till I saw the University of Berlin reports, where they actually looked at SARS-CoV-2 and showed that 99% destruction can take place. That really impressed me. That happened a couple of weeks ago. So I've been looking at this in some sort of detail. And face masks, of course, are going to be very critical in our protection, as we all know. And not just during this pandemic, in time to come. In fact, that's going to be a part of our body, it looks like, as we sort of move ahead. So I think we are at a very critical stage with a very critical technology. So I would like to understand how it works to create the kind of destruction that it does.
Good morning, good afternoon, Dr. Mashelkar. Thank you for taking this time for us. The first point I would like to answer is the technology has to work on a permanent basis. That means it has to be washable and reusable. That is the core of Livinguard, is sustainable technologies and not a one-time technology. So essentially, if you look at it, we sort of dye our chemistry onto the textile. The technology itself, is a what we call polycationic technology, or it's a positive charge. Now, positive charges are between 0.1 and 0.8 millivolts. These charges are not felt by the skin, and these charges work in tandem. So it is not necessary that if you have 0.1 millivolt, it will work against all microbes, or 0.8. You need a combination of charges to attack different parts of a microbe. Now, what do? We attack the cell walls only of a microbe. We don't poison. So there is no antibiotic, or there is no leaching of or transference of any chemistry from the surface of the textile onto the microbe. It is straight electrical charge, and that electrical charges, or multitudes of electrical charges, burst open a virus or a bacteria, and in some cases also some types of fungi. So we have this kind of multiplex of charges going on a non-stop basis. Now, once the virus or bacteria is dead or has been exploded, the charges are free to act again. And just for explanation, we have calculated with the ETH in Zurich, or the Federal Institute of Technology in Zurich, that in 1 square centimeter of our textile, we have between 24 and 36 billion charges of different amplitudes. And this is what causes the killing action. So once the microbe is in contact with our textile, they are dead.
Mm-hmm.
Yeah, oh, that's how it works.
Got it. That's very interesting indeed.
Yes. I can put on a face mask. So this is our reusable, washable face mask. And then this is a new solution that we're going to launch. It's a glove. It's a simple cotton glove that's also washable and reusable with the same technology. So what you're going to be able to do is grip a lot of places and also prevent major cross-contamination. So we think that a mask, a glove, and then a simple product which is a wipe, which is also washable and reusable, to wipe down surfaces, like, for example, if you're in a plane or if you're going onto an aircraft and you want to wipe your seat handles or the tray in front of you, then this would also be very effective. So this is a wipe, a glove, and a mask. Okay, while we're waiting for Dr. Mashelkar to try and reconnect, I think he's got a technical problem. Would you like me? I would like to show you around the lab. And this is our lab in a small village called Gams in Switzerland. So this is a chemistry lab. This is where we run all our chemical formulations. Yeah, is that okay? Okay. So these are some of our biosafety cabinets and chemistry safety cabinets, all the exhaust systems, so that we don't pollute anything. This is some plastics that we are formulating now to make cell phone covers, actually. And this is some of our mixing equipment for chemistry and synthesizing chemistries. Then we go past Victoria here, and we are a typical Swiss company. We have people from England, China, Holland, Lithuania, Poland, India. All of us work in the same company. So these are some of our analytical equipments. This is young Manuel, who's doing all our polymer testing. So here's where we do analysis if any of the chemistry is coming out. These are some of our refrigerators. which go up to minus 80 degrees Celsius. All testing going on here. And this is our textile laboratory. Over here is where we do actual fabric testing, treating, dyeing, mixing, and blending. So this is the first floor, and at the below us is our cellar where we have all our microscopes and other equipment that need even stronger foundations. So this is a brief and quick tour of the lab. We have an office outside. Dr. Mashelkar is back.
Can you hear me now?
Yes, sir. We can hear you.
I think video has gone off.
Yes, that's okay, sir. But let's talk at least.
Yeah, we will talk. We'll
okay.
Talk. Yeah. So I heard this exciting science. What I want to know as a scientist, as you know, I'm a polymer scientist.
Yes, sir.
And looked at these sorts of materials, polycationic polymers. You know.
Yes, sir.
You have so many of them: polyallyl amines, polyl-lysine,
yes, sir.
polyethylenamine, even chitosan.
Yes, yes, sir.
What is so different about your technology in comparison to these polycationic technologies?
So all the biggest issue is some of these polycationic chemistries are not compatible with each other. So what we have done is we have taken a blend of depending on the application, between 3 and 7 polycationic chemistries and mix them in a particular formulation. So our IP starts from, or intellectual property and patents start from how we mix the chemicals, how we synthesize them to become one chemistry. Then the second part is how we apply the chemistry on a textile so that it's permanent, or on a surface so that it becomes permanent. Because unless we are able to combine various chemistries together, you are not going to get the effect on a broad spectrum. So for example, the fabric on our face mask that we have here, this fabric also kills tuberculosis. And in July, we have got permission to test against Ebola. So we're going to test against TB. We've tested in India together with the Sion Hospital. So it kills tuberculosis. We kill all the influenzas. We kill E. coli, salmonella, and of course athlete's foot. So, but this is a broad. So you consider this as a broad spectrum, textile with a broad spectrum of killing capabilities, and the whole thing is to use a multitude of polymers, because most people only use one, and that doesn't work. And the other big issue is, Dr. Mashelkar, is we need to get at any cost a covalent bond. So between the substrate that we are treating, so if it's a cotton substrate, the bonding has to be permanent so that it's washable and reusable. And that is crucial. So a lot of these polymers that you're talking about are very difficult to bind to a textile. So, I went through maybe 1,000 polymers in the beginning, in 2010, 11, when the experiment started. We went through every available polymer to see, A, is it safe? And B, can it be bound covalently? And those initial tests, all those experiments are the cause of why we are able to find solutions so fast that are so effective. I mean, the COVID has been around only since 3 or 4 months, and now we are out there with a solution. It's all the information that we had over the past.
I see. Got it. Okay. So I think what you're saying is there is a continuous capture and a kill.
Yes.
And this covalent bonding as against weak bonding, which can be just destroyed by washing.
Yes.
Kind of a washproof sort of a situation.
Yes.
So that you can use it again and again. But
so
we have these 2 pliers and 3 pliers, single-use masks, and so on and so forth.
Yes.
So how does one compare? In particular, when it comes to India, we talk about cost, most importantly.
Yes.
But now, also worried about environment, of course. So in terms of cost and environment issues, how does it compare?
I'll come to the environmental issue first. I mean, in terms of pure mass, if you 1 million people wore a disposable mask versus our mask, it would be 36,000 tons less of environmental waste over the use of this mask. So, I mean, if one were to use this mask, as we say, for 210 days, right, 30 washes 1 week at a time, and compare it to the amount of disposable mask you would wear, it's 36,000 tons of saving. That's a lot, you know. And then in terms of cost, this mask doesn't cost more than 10 rupees per use. Now a regular mask also costs money, and every time you wear it, the bigger difference is once you've worn a mask that has no antiviral properties at all, right? The contamination is on the mask, and the problem with our habits is we tend to hold the mask to adjust it. Now, the moment you hold the mask to adjust the mask, your problem is going to be that your fingers have the virus on them. Then, if you rub your eyes or rub your nose, you know you have infected yourself, or you shake hands, or you touch a surface and you've transferred it. So in terms of cost per use, we are very, very, very cost efficient, and the environmental impact is incredible.
Yeah, I think the interesting point for me is that whereas the normal masks are preventive, yours are protective.
Yes. Yes.
And on a per unit cost basis. You know, I must tell you, Sanjeev, there is a great deal of concern now, because I understand that around the world now 89 million masks per month are being used.
Yes.
And they have to be disposed of. And within India also, as you know, it has been made. Our challenge here is that, you know, of course, hospitals take good care of them, but outside, for example, when they are used in society, community, etc., issue, because they get mixed up with the other ways. There is a contamination, household waste in the same bins it goes. There are no sort of separate bins. And what I'm worried about, very frankly, you know, apart from those who get affected by the virus, we are seeing health workers getting affected. But now I'm concerned about our sanitation workers, our rack pickers, you know, who sort of. So I think we must have finally sort of a solution, you know, which takes care of that. And as you said, touching the face or touching the thing itself can carry that infectious virus any distance. So I can see that in a particular sort of a context, more importantly, it's not just about killing or deactivating, it is protecting a human life. I suppose it goes with your name, Livinguard, anyway.
Yes. Yes, that's true, sir. Well, you know, from our perspective, you know, it's not a elitist mask or an elitist product. I mean, at the price per use, it is really available to everybody for use. And our aim is over the next few months and you know of time is to get as much of this to everybody as possible. So that's our aim. We have the mask currently, you know, being produced in the US for the US military. We have the mask being produced in Dubai, in Jordan, in Australia, in New Zealand, in Portugal, in Italy, and production is actually even going to start very soon in Canada, Mexico, and Brazil. So, you know, we are not a mask producing company. We designed the mask, of course, because we know how best to use our textiles. And what we are really doing is supplying the treated textiles that are made here in Switzerland, with one exception, which I'm sure you will ask me about. Otherwise, the entire world gets its textiles treated from Switzerland and made in Switzerland. And they are supplied globally, and then people make the masks in local areas. And that has a lot to do with the lockdowns and also the bans that are coming. So based on this, we've been able to, you know, get a supply chain set up so that we can globally supply the masks.
Yeah, but that brings me to another question, you know. Our Prime Minister has talked about Atmanirbhar Bharat.
Yes.
Atmanirbhar is self-reliant, wanting
Yes.
to stand on one's own feet. That does not mean we are closing our doors to sort of others. We do want to become part of the global supply chain. It is not about isolation, but integration. But there is a big emphasis on Make in India.
Yes.
So can you tell us, as far as your technology is concerned, the Make in India part of it?
Well, sir, I'm actually very proud as an Indian, and the masks are being made in India by Indians for India. Then the textile, with the only exception of Switzerland, is treated in our facility located in Navi Mumbai, and we are very thankful to the government of Maharashtra for allowing us to keep this facility running during the lockdown period. Since they knew that we are producing these masks and producing the textiles for the masks, we are now getting vendors who want to stitch the mask, who are qualified to make products and not send fakes out or duplicates. So we are working with vendors and producers to ramp up production for supply in India. That is our goal and aim. And it is the only other country in the world where we are treating textiles besides Switzerland.
Yeah. Because important.
Yes, we realize that, and that's being done.
But I want to come back to this safety and health because that's what I'm deeply concerned about, after the correction.
Yes.
Because someone is finding that people are trying to get such antiviral by using these technologies on heavy metals, I believe silver and copper and zinc and that sort of a thing.
Yes.
Because toxicity to me has to go hand in hand, with whatever we are sort of talking about. So can you tell the differentiator in terms of toxicity?
So as far as toxicity is concerned, I think that is you are killing microbes. What else are you killing? That is the first, or what else are you affecting? So when we talk about polycations and covalent bonding, the first thing we do is to make it a non-leaching technology. We were tested by the EPA for various aspects of toxicity under very stringent conditions, and each one of these tests that we did for toxicity studies is in excess of $200,000, and we did 3 of those studies. And then finally we got a report issued by a very, very renowned lab in the US talking about the toxicity, especially for the throat and the lungs of our masks. And when one examines the papers and technical literature available in public domain, I mean, the only resultant consequence of inhalation of silver, for example, which you raised, is death. Because it will finally reduce the functions of your lung and heart, and they will stop working. So I think the toxicity issue is one that one has to take just as seriously as the ability to kill a virus. One has to be just as cognizant of toxicity along with it.
Yeah, the same thing.
And we are very cognizant of that.
This is the same thing when we do drugs and therapeutics.
Yes, sir.
We not see whether the disease is cured. We look at the toxicity angle. No, so some of the drugs that are coming up for the pandemic at the moment, you must have seen that some of them are getting out very quickly because there are long-term toxicity effects. So I understand that, and therefore I think leaching, that means just washing away the metal and other contaminants, it's critical. I understand that. But Sanjeev, I have one this thing. I'm a man in a hurry. Mine to marketplace has to take place quickly, and I remember you were talking about this quite a few months ago. You were very excited. Why has it taken so long to come to this stage?
So two points. One is to get the SARS-CoV-2 available for testing has taken its time. Till they were able to isolate the virus and provide it to the universities for testing purposes. I mean, it took a little time. Then a protocol for an effective test that would be globally accepted, also took its time. Even though, and here we are talking about a protocol that normally takes 5 years, was completed in 8 weeks. We had scientists from the Swiss military lab, from FU Berlin, from the material sciences department of Aachen, and also from Arizona State University in Tucson, University of Arizona and Arizona State University in Phoenix and Tucson, who specialize in these things. We got them all together. We had many conversations, and we exchanged notes, and finally, under the supervision of Dr. René Gailey and Dr. Wouter Pronk, who are in our team, we could collate and make an acceptable protocol for testing. And then the test started at University of Berlin. As a surrogate test was first done in University of Arizona and Tucson. So we saw there was efficacy, and then based on that result, the FU Berlin, or Free University of Berlin, Open University of Berlin, started the testing. Now, even in their protocol of testing, they do one test first to see efficacy, and then they need to repeat the test at least 4 to 6 times by 4 to 6 different doctors or professors, to make sure that there is a sort of continuity, or that the tests are working, and that there is no one-off report. So it has to pass the test of other people testing, and it has to pass the test of it being efficacious at every test. So we took away the human element as well as the performance, and the results that we have that were published by the FU Berlin were based on all of these tests put together.
Very good. Yeah, I mean, that's wonderful. But as far as the regulatory authorities are concerned,
yes,
have you had approvals in hand?
We have an RFU, or an emergency use approval, now from the European Union. We have approvals from most Middle Eastern countries. We have approval from Australia. We are getting an approval from China. We are getting an approval from New Zealand. Japan is applied for. Canada is applied for. And the USA, we are in talks with the FDA. Unfortunately, with the FDA, the use of a textile which is reusable and washable, we are struggling to get them to approve our protocol, but we're going to do that.
Yeah, very good.
Yeah.
There are a number of questions that are coming up. I think we should be fair to them. But because as a scientist, I'm tempted, because as soon as I see some breakthroughs like this, I always think of the future and what else, where else, etc.
Yes, sir. Yes.
What you have done may be the tip of the iceberg, because
yes.
To me, Sanjeev, I used to talk about 3 Ds: decentralization, digitalization, decarbonization, etc. Now one has to talk about this decontamination as
yes,
being
sir.
a key, and
yes.
there is so much of sort of awareness, and decontamination, the whole world lies sort of ahead of us. So let's
yes.
end our conversation by talking about the future. What else can we do which can impact the humanity?
So on one side, we are going to expand our testing and our materials search for better polymers, safer polymers, and more effective polymers. Use less of the same chemistry and get more. So all that research is being done here in our labs in Switzerland. And on the other side, what we want to do is worry about areas that are of great concern. So one is, of course, the healthcare workers. They wear uniforms, and that is where the greatest amount of contamination is. Patients in hospitals, they're continuing to reinfect themselves because they're on dirty bed sheets, or I don't mean visibly dirty, I mean, dirty in terms of microbial contamination. And the problem is, when you get an infection like COVID, you are susceptible to other hospital infections. Like, for example, all the, resistant drugs. You have the antibiotic resistant drugs. So our textile kills all of them. That we've tested many years ago. And we therefore believe the healthcare. Now, the other big industries that have been affected, of course, besides healthcare, is the hotel industry, the restaurant industry, and the airline industry. People want to travel. People want to go from a place A to place B. So our focus will be on getting those textiles that work in these areas to perform and provide protection to these industries and to the people working in these industries.
Dr. Nimal Ganguly was talking to me on the other day. As you know, he was former vice CIMA.
Yes.
And one of the things he talked about was air conditioning.
Yes, sir.
And the challenge that it is posing. So when you are looking at different areas, are you also looking at some areas like this?
So air conditioning, we have developed a very fine filter mesh with a partner company in Switzerland. And we've also developed a mesh with a non-woven mesh with some partner companies in Germany. And those tests are ongoing. We should have a solution in air conditioning. I believe, I'm an optimist. I say 3 months, my scientists say 6 months. So between 3 and 6 months, we would have a solution for air conditioning. I believe we'll also have a solution in surfaces like plastics in 3 to 6 months. Air conditioning is a big focus because we are looking at a solution to retrofit existing air conditioners with our filter. That's all.
Yeah, I think we should conclude now our conversation because there are a number of questions. I can see 18 of them. I'm sure you are able to track. So I think you can respond to the
question. Let me get it out. The first question was, please tell us how this product or this technology is going to get us out of these surreal times. I don't think it's the only answer. It is a big part of the answer. I think a lot of the answer has to do with our behavior also. We have to change our behavior. And if we change our behavior and protect ourselves with technologies like Livinguard, I think it's going to get us out of these times. I think Dr. Mashelkar answered the question from the environmental impact. Yes, the answer to the US military contractor is manufacturing your mask. The answer is yes, it is for the US military. Somebody asked us about a country wanting to buy these masks for distribution within itself and all around. The answer to that is that we have several countries that are actually buying masks. I cannot, for confidentiality reasons, I can't tell you which ones, but not one, but several countries are buying masks and distributing them amongst their citizens and also neighboring citizens that can't afford it. Yes. How many times are these washable? Minimum 30 times. What is the cost of the products? Right now, the mask is going to retail at 2,000 rupees. So it will come to about, if you look at it for 30 uses, so it comes to about 6 rupees or 7 rupees a use, depending on how you look at it. India is one of our focus areas. We are definitely going to do that. The capacity of masks in India currently is about 150,000 masks a week, but we will take it up in a gradual or in an expedited form as the market demands, and we will adapt ourselves to what the market needs. I've answered about the prices of the mask. And what is non-leaching? Non-leaching means that none of the chemistry that is on a textile surface leaves the textile and enters into, let's say, the drinking water. Now, you can only do that with one process, and that's covalent bonding, which we do. And if you don't have a covalent bond, you have to use a glue of some kind. And glues are not very effective, especially when you are using soap and running water. And that's when leaching occurs, or the chemistry leaves the textile surface and goes into the water. I have shared the cost of the mask in India. The masks are available in India right now. We are giving it to doctors and to institutions. A lot of institutions are buying it. And I believe in the next 10 to 12 days, it will be available with 2 or 3 of the leading e-commerce sites. I have a question. You say this mask kills viruses. Yeah, it kills a lot of viruses and bacteria, including tuberculosis, influenza. We have tested it for yellow fever, and we shall be testing it very soon for Ebola in July, which is an uncurable viral infection right now. Okay, I need a little time to अन्य बीमारियों के लिए भी, yes, you can use this, अन्य बीमारियों के लिए भी ये उपयोग कर सकते हैं, right? There are no, we have toxicity studies, Mr. Sharma, that while it kills a coronavirus, there are no adverse effects to the human body. That test has been done. It's a Swiss company with labs and textile manufacturing in Switzerland. We have a subsidiary that is licensed to apply the technology in a manufacturing unit in Navi Mumbai. This is available in Madhya Pradesh and all over. We have channel partners, and we will list the channel partners on our website, so that you can talk to them and you can get access to the mask. We will be licensing the manufacturing to several partners in India, but we will not allow anyone else to apply the technology on textiles other than our own plants. Not only for the reason of quality, but also and secrecy, but also our plant is designed to also apply a version of our technology for drinking water textiles, which are all across India, which Dr. Mashelkar spoke about earlier. And we have very high standards of manufacturing processes that we will find it impossible to train others to do. Okay, the Sion Hospital, we work with the Sion, 4 doctors in the Sion Hospital to do a test on both tuberculosis and on the contagious or the non-curable part of tuberculosis. We have done both. Yes. The mask is available in India. And what is your focus on tackling Ebola? Well, we are not. We are working with the Swiss authorities and the WHO to test our textile for killing Ebola, because they have a lot of healthcare workers in Africa now that are getting the disease because there is absolutely no cure whatsoever for it. So that's what we're doing. These masks have been worn already by virtually every leading doctor, whether dentist, ophthalmologist, or surgeon in India, the masks, and we have many references where they are extremely pleased with the mask, because A, it is very comfortable, and B is it's also, it protects them and protects their patients. So washing of this product is the next question. All you have to do is take it under a tap, rinse it from both sides, and if there is a stain, you can rub it out. If it's very dirty, and then you can use soap, or there's no need to use soap. Just use a little water and rinse it off, and that's good enough. Just getting rid of the dust and dirt. Okay. E-commerce I've answered, and pharmacies we are looking at how it is. The formal launch of the products is today. So we are offering these products in India from today to a lot of people. A lot of companies have bought it for their staff and employees already. Yeah. Oh, we have many patents. We have filed over 100 patents, and these patents are global. And we intend to file many more patents in the future. And our idea is always to make our 1-year-old or 2-year-old patent redundant by filing better and newer and more improved technologies. So we have to continue that. So the question on the adverse effect of the human body. So there are several tests for this. They're called cytotoxicity tests. They are called skin irritation tests. They're called deep dermal toxicity tests and skin toxicity tests. So one has to take a treated textile, and some of those tests last even up to 3 months, and where they are in contact with the skin or they're in contact with mucus, and They are looking at any changes to the skin, to the flora and the fauna. These tests have not only been done globally, also in India, and we have passed all the tests, and there is no toxicity at all. Okay, we are talking to the TB doctors now, and getting the masks across to them. The TB patients have a problem that their lungs are very, very weak. So we have worked with a company to design a high breathability non-woven filter media that is of course washable. This is a challenge, and that is being tested right now, at which point we can put it on onto the TB patients and protect them and protect those that are around the TB patients. So is this mask also useful for other diseases? Any disease that can be transferred through your lungs or through your respiratory tract, yes, it will be very useful against all of those. Yes, this mask will not make you, there is no such thing as 100% protection, but for the coronavirus, we have seen there are enough papers available in the press and in the media and by scientists to show that if you are wearing a good mask, the chances of getting coronavirus are drastically reduced. So yes, it is a safety, a huge aspect of the safety against the coronavirus. We are not making this a high-priced mask. We are looking at ways in which everybody can get this mask. It's a challenge, and we are up to this challenge, and we'll make it that it is a mask that is available to all. Right? We have colors. Right now we have navy blue. We are adding colors. We are adding an olive green. We are adding black. We are adding a dark red, the color of Dr. Mashelkar's jacket or pocket insert. So we are adding that as well, and lighter colors and more feminine colors for women. I mean, colors will come, but right now the focus is on protecting the people and not worrying about fashion too much. The brand of the mask is Livinguard. You will find a Livinguard logo on all our masks. And then, depending on the distributor of the mask, for example, in the Middle East, it's sold under the brand name FineGuard. In Europe, there will be several brands like Clarion or 5log selling it. In the US, it's Ready One, which is a very unique manufacturer. They only employ disabled people and US veterans, which is why they got the contract to manufacture for the US Army. This mask does not contain any chemicals. It is impregnated with chemicals, but none of the chemicals come off. Yes, we have actually given the mask to a lot of the municipal workers in Mumbai, and that's where we are. So we started there. We gave it to a lot of doctors, and a lot of the companies we are working with are using their CSR capabilities to give the masks to frontline workers. And as Dr. Mashelkar said, we should get it across to the sanitation workers who are really high exposed, right? Whether it becomes the standard equipment of an operating theater, that is a question that only the FDA will answer. It's really not something that we can answer. So again, the cost is about 6 to 7 rupees per use in the mask, and I'm sure that we will be able to work out things so that to make it affordable to the people. So if most of the other masks or other products use silver and zinc, and being elements, the only way these products can be attached to a textile surface is through a method of gluing. So you need to glue silver or zinc to the textile, and the moment you have the humidity of your breath and you have water and everything else on your breath, and the mask will become wet over a period of time, these glues tend to loosen up, and then you start inhaling, metals like silver and zinc. And there is enough research globally available to show you inhalation of metals is not exactly healthy, right? Yes, this can definitely be used by doctors treating TB patients. Am I originally from Bombay? Yes, I am half Parsi, half Tambram, as they call them. I am born in Bombay. I went to boarding school in Ajmer, and I studied in Germany, and then I worked in India, and now I work in Switzerland.
You must also be there in Pune for 8 years.
Yes, I spent 8 years working in Pune, and then I moved to Bombay and set up a textile treatment facility in 2000. And that is the facility that today is used by our company to treat textiles. And that's where we've licensed it. Yeah. The price of the gloves, wipes, I have told you, the price of a pair of gloves we will come out with this. We are getting the textiles done. Of course, we have to worry about it being smartphone compatible. So we're doing that. So the price of the mask is 2,000 rupees in retail, with including tax, and we're hopeful that the e-commerce sites will give payment plans on this. So, and it's basically coming down to 6 rupees per use. There is no biohazard with our mask for the simple reason it's a positive charge. Most bio areas, and this is 100% cotton textile, so it is biodegradable, and the polymers used on this get neutralized the moment they come into any landfill. So there is no biohazard at all. Yes, it is suitable for people with breathing issues, and since we've got doctors who are working with this mask on for 8 and 10 hours, you have very, very good breathability in this mask. No, we have got 3 types of masks. That was the next question. You have 3 types of masks. We have what we call the Pro mask, which is a basic mask that is a medical grade mask that you can wear in indoors or in places that are air conditioned or at least air controlled. We have the Ultra mask, which is an outdoor mask with a breathing valve that would be for people like police officers or people who are outside and spending a lot of time outside. And then we have what we call the Comfort mask, which is basically for people who are in a safer environment and don't want the filter media but just want some basic protection around the face. We're also introducing a sports mask for people walking and running, and so that breathability is even more easy. Is this the Indian government looking to distribute this to frontline workers? I have no idea. I haven't been told. I can't comment on that. Is mask useful for cancer patients? Actually, this would be ideal for cancer patients because their immunity is very low, right? I think something like this would offer them a great degree of protection from other infections that they could possibly get. So the factory is located in Navi Mumbai. Currently, we are stitching in Bangalore, around Bangalore, not in Bangalore. The sewing is going on around Bangalore. And the answer is yes, we plan to make it in India. This mask, the Comfort or the street mask, can be worn for jogging and exercising. Mask kab tak market mein ho jayenge? I think 7 to 10 days, sir. Yes, online it will be available very short. Should I use a mask with or without a valve? A good question. As I said, if you're indoors, you should use the mask without a valve, would be better. And if you're outdoors and you're working, as a frontline worker, I would use a mask with a valve. But that's my opinion. And as an inventor of a product, I think we should differentiate where you're located and how you wear a mask, right? The pricing of the masks will be made available on our website very shortly. Yeah, we will find CSR money and from our partners and to get masks to sanitation workers. I'm sure we'll figure out how to get it across to people who can't afford it. That's not going to be a problem. So times, I've said you can wear it 30 times, and you can use it for a week without washing unless it gets really dirty, and then just wash it, right? When you're driving the car, yes, you can wear this mask very easily, right? No other mask manufacturers cannot use our technology because they don't use our fabrics and our textiles. No, we are not looking for any investors or funding in India. The plant is located in Turbhe, in MIDC in Turbhe. Yeah. What is the justification for ultra premium pricing? Well, it's the cost of developing the technology and also the cost of chemistry and applying it. It's not a simple process. So it's basically a very expensive technology, and we're trying to make it as affordable as possible. We use chemistry to get the charges on electricity, chemistry to get the charges on the textile, not electricity. Yes, we can make full body suits, and they will be coming out soon. Yeah, a single mask is about 2,000, so it's less than 10 rupees per use. Yes. Okay. So I have answered all the questions. If there is anything else, I'd be happy to answer them. You can send us an email, and we will answer those as well.
Yeah, I think you have volunteered to answer the questions if they are sent to you by email. I think, in fact, yes. In no session have I seen 50 questions being answered. So you have created a kind of a record.
Thank you, sir.
All meaningful questions. I think all good things have to come to an end. We are targeted at 4 o'clock. I find 3:57, 3 minutes. So if it is okay with you, shall I conclude?
Yes, please, sir.
Yeah, I would just say that about a week ago, I gave a talk on the pre-COVID world and the post-COVID world. Because now people talk about ACN PCS, pre-COVID and after COVID. And in that, my tagline, my entire lecture was on a tagline, and which I will read out to you. The pandemic is indeed humbling, but an acute reminder that scientific thinking and action is our only defense from the predators of nature, our only defense. And what you have demonstrated is science at its best. So as a scientist, I feel very, very happy about what you have done. There are a couple of things I forgot to mention, by the way, because what I'm worried about, I saw a paper in Lancet, by the way, which is our best journal. And I'll send you a copy of that. What it has shown that even on a surgical mask, after 7 days, they had a sort of, the virus sort of alive. So it's a matter of great worry. And India is concerned. The principal scientific advisor to the government, along with Invest in India, had just announced that for such technologies, that is biomedical waste disposal technology, they are creating some grand challenges. The final date they are saying is 15 July and so on. So the whole nation is concerned about not only the patients, those infected, not infected, but also people who serve them, the health workers and so on and so forth. So I think I'm looking at it, even as an old man, as something where science doing good for the society, for the people. So I must thank you. I must congratulate you, not only you, but your entire team. And I think what we have is just the tip of the iceberg, because as I said, among all the 3 Ds that I talked about, disinfection is going to be the key, because sanitation is going to come at the sort of a front end. So it has been a special pleasure and privilege for me to interact with you, Sanjeev. And
thank you, sir.
All my choices.
Thank you, and thank you for your time and your insights as well.
Thank you.
We will continue to be inspired by you, sir. Thank you.
Thank you.
Thank you.